Hello and welcome everyone. Thank you for joining today's presentation from MassHealth and the Health Connector, where we will share information about renewing your MassHealth coverage or obtaining coverage through the Health Connector. Today's presentation is keeping or getting coverage through MassHealth and the Health Connector, and we will get started at 1 p.m. today as scheduled. Hello and welcome everyone. I'm Nuri from the Massachusetts Health Connector, and today I'm joined by my colleagues Elizabeth from MassHealth and Nikki from the Health Connector, who will be presenting today's information. Together, we are here today to share information about renewing your MassHealth coverage or obtaining coverage through the Health Connector right now. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support on promoting this webinar, including our partners in the state legislature and our congressional delegation. But before we get started, we just want to share some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 to 40 minutes, and then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the question and answer button at the bottom of your screen, and we will be monitoring your questions throughout. Please, we ask that you do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the MassHealth Customer Service and the Health Connector Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar, and following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So without further ado, I'll pass this on to my colleague, Nikki, to get us started.
Thanks so much, Nuri, and thank you again, everyone, for joining us for today's presentation, Keeping or Getting Coverage Through MassHealth and the Health Connector. So I am going to start us off and just talk a little bit about the topic for today's session. As folks know, MassHealth needs to renew coverage for all members to make sure that they're still eligible and receive the best health insurance coverage that they qualify for. So today, Elizabeth and I will explain about how to update your information to renew your MassHealth coverage, and also talk about whether or not, if someone no longer qualifies for MassHealth, how to get coverage through the Health Connector or get help paying for the cost of coverage. So the agenda we'll go through is explaining MassHealth renewals. Elizabeth will tell you why renewals are important this year. So this has been happening to start a few months ago, and she'll explain that. And renewals will be going through 2024. She'll tell you how you can prepare for upcoming MassHealth renewals, explain what you need to do if you get your renewal form in the mail, and tell you how to help complete your renewal if you need some assistance. Now, as you can imagine, I'm here from the Health Connector and Elizabeth is here from MassHealth. So there is a relationship between our two organizations, although our plans, our coverage is different. So Elizabeth and I just wanted to give you a little bit of background on MassHealth and the Health Connector so you understand why today we're presenting together as MassHealth is going through its renewal process. Elizabeth?
Thanks, Nikki. So MassHealth is the state Medicaid or CHIP program. So we provide health coverage and help paying for health coverage to children, families, seniors, and people with disabilities who live in Massachusetts and meet our requirements to qualify. We are public health insurance, but we cover the same services as private health insurance and more oftentimes, particularly for long-term services and supports and certain behavioral health services. We currently have about 2.3 million members who are on MassHealth. This includes about 220,000 older adults and 300,000 individuals with disabilities. When you look at what that means for the percent of the broader Commonwealth that we cover 67% of people who are in low-income families. And overall, we cover 25% of people who live in Massachusetts overall. For kids, that's even higher. We cover about 2 in 5 children across all income levels in Massachusetts.
Thanks, Elizabeth. And when you look at the Health Connector, I think what I really want to convey here is that we're the state's health insurance exchange or marketplace. So we're here for people, individuals, families, and small employers. It's really a place to buy affordable private health coverage. So for people who don't qualify for MassHealth or who don't get access to health insurance coverage through their job, a spouse's job, a partner, they can apply for coverage through the Health Connector. And a lot of people who apply get help paying for the cost of that coverage. And some even are eligible for $0 health plans. We're very excited to explain that coming in 2024, coming this year, there are going to be people with higher incomes who will now qualify for coverage through the Health Connector. And it's always important for us to remind ourselves and you that people can also buy dental insurance through the Health Connector. And you may be wondering, you may be thinking, okay, I understand that MassHealth is the state's Medicaid program. I understand that the Health Connector is the state's marketplace. But again, what is this relationship? So as a resident of Massachusetts, you don't need to know which health insurance coverage you're applying for when you are looking for coverage. So all you need to do is complete one application, and that is for MassHealth, the Health Connector, or if you're looking for help paying for coverage. People can apply online. We have a website at mahealthconnector.org, and you can see the image on the left, and that's what the application's landing page looks like. We also have the application available in Spanish, and the URL is listed on the page. And again, this is one way that people can both apply for health insurance coverage and also log in to their online account and make updates and changes. Now, Elizabeth is going to go through a lot of detail around, exactly who can use this online application and which populations or which folks may need to use another method to either apply or update information with the Commonwealth. So I will pass this presentation back over to Elizabeth to go through all of that detail.
Thank you so much, Nikki. I want to flip to the next slide. So when we talk about MassHealth renewals, what do we really mean? So federal law requires MassHealth to regularly check if our members still qualify for MassHealth. This check that occurs every year is called a renewal or an annual review. When you are selected for review, we will try to see if we can automatically renew them. But if we cannot, we will send you a renewal form in the mail. These renewal forms are sent in blue envelopes to the head of household. And the head of household is based on the tax filing relationship. The first person or person one that you listed on your application, then their spouse independence claimed. As I mentioned, some members we may be able to automatically renew. If this is the case, we'll send you a letter sharing that your coverage has been automatically renewed, but we won't send you a full renewal form. But if we do not have enough information to renew a member automatically, then we need you to provide additional information. And we will inform you of that by sending you a renewal form in a blue envelope. And if you don't reply to that blue envelope, your coverage may end. So as some of you may know, while these are an annual process, they've largely been on pause during the COVID-19 public health emergency. During this time, the federal government required states to provide continuous coverage, meaning that even if your income increased or you didn't reply to a renewal form, you would maintain your coverage. This continuous coverage protection ended on April 1st. And MassHealth began the annual renewal requirement for members at that time. As I said, some members will be renewed automatically and won't need to take action, but all other members will need to reply to a renewal form. Member renewals are occurring over 12 months, so you may get your renewal form anytime between this past April through April 2024. As I said, whenever possible, we will try to process your renewal automatically. This means that we look at the data we have on file from you and the data that's available in state and federal sources. And if we can match those and confirm that means you're still eligible, you won't be required to complete that form that comes in the blue envelope. You may be more likely to be automatically renewed if you get SSI through Social Security, because you're 65 and older and have limited income, or because you're someone with a disability and have limited income. This also may occur if you get temporary assistance for needy families through DTA, or are or have been in custody of the Department of Children and Families or the Department of Youth Services. But the most important takeaway, as you'll hear me say a lot, is if you get a blue envelope with a renewal notice from MassHealth, you must respond. As part of the end of those continuous coverage requirements, we're also returning to standard eligibility rules. So if in advance of getting your blue envelope, you reach out to let us know that your income has changed, that may affect your eligibility. It may cause them to stay the same, increase, decrease, or end. If you would like to only update your contact information, such as where you live or the best email or phone number for you, you can call us at 800-841-2900. If you haven't yet received your blue envelope, the most important thing you can do is call us to make sure that we have your accurate mailing address, phone, and email address so we can reach you when it's time for your renewal. In addition to sending that blue envelope, we're also doing text messages and email addresses if we have your right information on file. That can be really helpful, particularly if folks have moved recently. You should also read all mail from MassHealth. While those renewal forms will come in blue envelopes, there will be other important information that may come in a more standard white envelope that will require you to respond. So make sure that you're reading all mail that comes from MassHealth or the Commonwealth of Massachusetts. This is the blue envelope that I mentioned. It's bright blue. It has this little response required sticker. And also keep an eye out for that auto renewal letter, which I mentioned, which will come in a white envelope. There are 4 ways to complete your renewal for most members who are under 65. The easiest way is using that portal, mahicks.org. That link will also be in your blue envelope. Your second option is you can fill out the paper application and you can mail it to the Health Insurance Processing Center in Taunton. You can also call our MassHealth Customer Service Center to complete the form over the phone, or you can make an appointment with a MassHealth representative for an over-the-phone or virtual appointment. You can also walk into a walk-in center at one of our MassHealth enrollment sites. You will have 45 days to complete and return your renewal form before it may impact your coverage. So for members who are 65 and older, there's also 4 ways, but they're slightly different. Individuals who are 65 and older, who live at home or any age, or who are any age and get nursing facility care or in a home and community-based waiver, the easiest way is if your renewal notice has an e-submission number, you can upload your renewal at the link on the screen. The second option is you can fill out the application on paper and mail it to the MassHealth Enrollment Center. The third is you can call our customer service center to complete your renewal form over the phone, or you can make an appointment or walk into a MassHealth Enrollment Center. You also have 45 days to complete this form. There's also a number of resources that can help you. The first are those MassHealth Enrollment Centers that I mentioned. They offer phone, virtual, or in-person help. You can make an appointment for phone or virtual support, or you can walk in for in-person support. There's 7 MECs across the state, and the website linked here will allow you to find the one nearest to you. There's also individuals called certified application counselors and navigators. And these are community-based resources who can help you complete your application for MassHealth or your renewal form as well. They're trained by our state staff, but they're not officially part of the state government. And these are wonderful resources and folks who can help you have your questions answered, understand the best places to go, and just allow you to get the best benefit you really qualify for. Their help is free, but in certain cases, you may need to schedule an appointment, and you can learn more at the link on the screen. And of course, you can always reach out to our customer service center. We're open Monday through Friday from 8 a.m. to 5 p.m. And you can get help in almost any language, English, Spanish, Portuguese, Mandarin, Vietnamese, Arabic, and Haitian Creole. We also have a language line interpreter for other languages as well. So in terms of how long you have to respond to renew, first, if we're able to automatically renew you, you won't need to take any action to maintain your coverage. If you do get that renewal form in the blue envelope, you'll have 45 days to respond. If after that you respond to your renewal form, but let's say we still need more information from you, you'll get what we call a request for information, or RFI. And for this, you'll have 90 days to respond to that request. If you get a termination letter, meaning that your coverage is ending, either because you applied to a renewal form and you're no longer eligible, or because you didn't reply and your coverage ended as a result, you will typically have at least 14 days between when you receive your termination letter and when your coverage ends. If your MassHealth coverage ends because you didn't respond to your renewal, you'll have 90 days in which you can complete your application and have your coverage renewed back to the date it ended, as long as you call MassHealth within those 90-day window and are found eligible. This reconsideration period only applies if you fail to respond to a renewal notice. Otherwise, if your coverage ends, you would have to reapply to see if you're still eligible. Also, if you don't want to wait for that blue envelope, you can choose to renew early by going online and updating your information or calling us. If you do choose to do your renewal early, your next renewal will be about 12 months from the date in which you're renewed. And you can update your contact information without going through your renewal by calling us. As I mentioned earlier, we're also making sure that we're able to support folks whose primary language isn't English. So we've put together flyers, posters, and key messaging in our member toolkit that's available in English, Spanish, Portuguese, Haitian Creole, Vietnamese, Khmer, Chinese, Arabic, and Cape Verdean Creole. We're also doing outreach through our partnership with Healthcare for All, which includes local language TV and radio ads. We've also provided grants to community-based organizations, including those who are focused on immigrants or refugees. And we've also published vlogs that have American Sign Language. And we've offered American Sign Language for live renewal webinars that we previously held. And of course, if you ever need a translation support, you can always call our customer service center at the number on the screen to get translation support. In addition, the contact center has reps who speak English, Spanish, and Haitian Creole, in addition to the language line where they can bring on an interpreter who can help you. We also have published a list of community application counselor organizations who speak foreign languages. We're also in the process of hosting some enrollment events across the state where there are interpreters. And for individuals who speak American Sign Language, we also offer on-demand VRI in person at the MassHealth enrollment centers. If you no longer qualify for MassHealth, you can still find affordable coverage. So you should still complete your renewal form, even if you think you no longer qualify. I'll talk more about the Health Connector options later on, but they are, of course, a great affordable plan option for members under 65. For individuals who are 65 and older, if you don't qualify for Medicare, you may qualify for the Health Connector. Loss of MassHealth is a special enrollment period, so it allows you to enroll outside of standard enrollment periods in Medicare. Members who lost MassHealth because they lost SSI income due to certain conditions may be able to reapply. And if you're no longer eligible for MassHealth, you may qualify for Medicare Savings Program, which is a federally funded program, also called MassHealth Buy-in, which pays for some or all of a Medicare recipient's premiums, deductibles, co-payments, and coinsurance. Individuals may also qualify for the Frail Elder Waiver, FEW, the program of all-inclusive care for the elderly PACE, Prescription Advantage, and other programs or services run through Aging Services Access Points, or ASAPs. You can learn a lot more about the renewal process and coverage in our MassHealth Renewal Help Guide, which you can find online. And you can also learn more about the redeterminations or renewal process at mass.gov/masshealthrenew. And I'll leave you with just a few tips and reminders. If you're under 65, the best way to renew your coverage is online using your MA login account. If you're 65 or older or in a nursing facility or HCBS waiver, you can find information about the best way to renew your coverage at mass.gov/masshealthsaka. Make sure to call MassHealth if you've moved or need to update your contact information. Of course, we may, as this process continues, see longer than usual hold times at the customer service center. And you may not get your renewal forms right away. They can come anytime from this past April through the end of April 2024. There are certainly lots of resources to help you, such as in the MEX Customer Service Center, CACs and navigators in your community. So make sure you reach out if you have questions and need help. And we certainly want to do everything we can to help you and make sure you have the best coverage that you qualify for. With that, I'll hand it off to you, Nikki.
Thanks so much, Elizabeth. Thank you for all that information. So as Elizabeth mentioned, there are going to be some folks who no longer qualify for MassHealth and maybe don't have another option to get their coverage. So we want to talk about how the Health Connector can be helpful in that situation. So Elizabeth touched on this a little bit, but I just want to reinforce this. Just a reminder, if you lose MassHealth coverage, it's considered a qualifying life event. Now, this is going to give you a special enrollment period to enroll in or change health plans outside of the annual open enrollment period. So typically with the Health Connector, life events that let you qualify include things like changes in household members. Let's say you've added members have left the household, income has gone up or down, a change to immigration status, a change of address, or if someone's getting married, having a baby, adopting a baby, or if someone loses coverage that they're getting through a job. For the Health Connector and for, any coverage that you have, really, if you have a qualifying life event, you want to report that as soon as possible. And while you're in the special enrollment period, we still have to be with the payment and enrollment deadlines. So those deadlines still apply even if someone is in a special enrollment period. Something for folks to consider. I know we have a number of people on this call, and I know a number of people going to watch this recording and review these materials. There may be some MassHealth members who are able to get coverage through their job. So as Elizabeth had mentioned, these protections have been in place. They were in place due to COVID-19. So if someone is now working, it is important to look into and see if you might qualify for coverage through your employer. So you can contact your human resources or benefits department, and you just want to look into things like finding out, based on the current position you have with the company, are you a benefits eligible employee? So do you qualify for coverage for yourself or your family? You want to find out how much the plans cost and what you need to pay versus what they're going to cover. And then also find out about their deadlines when you need to decide to enroll in employer-sponsored health coverage and any other steps that you might need to take. And as a reminder, if someone has access to affordable coverage through an employer, they're not going to be able to qualify for financial help through the Health Connector. So if the coverage the employer offers is not affordable according to the state's affordability standards, Health Connector plans and savings may be available, and you and your employer are going to need to answer questions about plans and the costs when you're completing the application. So based on those responses, that will help the system determine if you and your family can qualify for savings through the Health Connector. Now, just a couple of things about Health Connector plans. So all of the plans sold through the Health Connector or the state's marketplace meet state and federal standards for coverage. So these are comprehensive plans, and they're called qualified health and qualified dental plans. So depending on where you live, you're going to be able to choose from plans from leading insurance carriers in Massachusetts. So again, depending on where you are, you'll have a set of health insurance options that are offering services in your area. Now, unique to the Health Connector as the state's marketplace, you may be able to qualify for tax credits to reduce the cost of monthly premiums. So you could enroll in a health plan with advanced premium tax credits as savings. And then last on the list here that we'll be talking about in more detail are connector care plans. And this is unique to the Health Connector as well. So people in more income levels who meet all the eligibility requirements towards plan year 20 beginning in 2024. So we previously had Fallon Health, New England, Health New England, Mass General Brigham Health Plan, Tufts Health Plan, and WellSense. We will also have connector care plans from Blue Cross Blue Shield of Massachusetts, Harvard and Pilgrim Healthcare, and United Healthcare. Now, these changes are going to be in place when open enrollment begins at the Health Connector on November 1st. So what that practically means for a consumer or a current member is beginning on November 1, when you start seeing, when you start looking for your new coverage for the new year, you will see these new plan options, and you'll also see that the income limits have increased. And again, all of this you'll see beginning November 1, but it does not apply or does not take effect until January 1. So I just want to talk a little bit more about these two concepts, because I know these are these could be new concepts for people or new program names. So advanced premium tax credits. So these lower the premium amounts that someone pays each month, and the IRS sends the tax credit that someone is eligible for directly to the health insurance carrier. So as a member, you simply pay less each month, and you don't have to, reconcile any of that stuff. But essentially, you have a choice. So depending on the amount of tax credits you get, you can decide to take the full tax credit amount or take a smaller amount of tax credit. And we can explain that and talk about that further if people have questions. But the Connector Care program offers great benefits. And the way in which we're able to do that is we use the federal advanced premium tax credits plus state dollars, and those two together reduce the monthly premium someone who's eligible needs to pay. Also really important. So yes, you'll see lower monthly premiums, you'll see low out-of-pocket costs, and really important, there are no deductibles for people who qualify for the Connector Care program. And depending on your household size and your income, depending on what plan type you qualify for, you could be enrolled in a $0 plan or pay as low as $255 a month for your coverage. Now, as Elizabeth was talking about the MassHealth renewals, just wanted to remind everyone is that if people are losing MassHealth coverage, if that coverage ends, they may qualify for financial help through us, through the Health Connector, to lower their monthly premium amounts. And really important, the Health Connector, because we're the state's marketplace, we're the only place somebody can access state and federal subsidies. I mentioned how we reduce the cost of the Connector Care program. And I just want to also note that if someone isn't eligible for the Connector Care program, they may still qualify for those federal advanced premium tax credits that I described, and that helps lower the monthly premium bill. And again, if you enroll in a plan through the Health Connector, just know all of our plans meet state and federal coverage standards. So you never have to worry that you would be penalized on your taxes for enrolling in a non-compliant plan. So I had previously said that beginning in 2024, we're going to see lower premiums and lower copays and no deductibles for more residents of Massachusetts. So in practical terms, if you're an individual, these changes are going to increase the income limit for Connector Care from $43,470 to $72,900. And for a family of four, the change increases the income limit for the Connector Care program from $90,000 to $150,000 for 2024. And I mentioned plan types very briefly. I want to explain that on this chart, depending on somebody's income level based on the federal poverty level, depending on what they enter into the application and what the system determines as someone's eligibility, they're going to be, if they get approved for Connector Care, they're going to be slotted or approved for a particular plan type. On the second row here, or the last row here, you're seeing the minimum monthly premium. So folks who are in plan type 1 or plan type 2A, if they choose the lowest cost health insurance plan, they will be paying $0. But as you can see, if you're going up in income, you can choose to enroll in the lowest cost plan, but the lowest cost plan does increase in price. Okay, so we're going to just recap a couple of things for you. So there are a couple of ways to apply or update your application. Elizabeth mentioned MassHealthConnector.org, and I also explained that we do have a Spanish website. You can update or apply by phone or with the help of a community organization or health center. And as a reminder, there's one application. If you're under 65, there's one application to find out if you qualify for coverage through the Health Connector, including help paying for coverage or coverage through MassHealth. Now, really important, I feel like this is part of our PSA, just know because MassHealth and the Health Connector share a system, you'll also get notices from both organizations. So we just like to, let people know in advance that that is something that does happen. So we don't want this, there's nothing wrong in the system, but you do need to, we do legally need to tell you that you are eligible or not eligible for one or other of the programs. And as Elizabeth describes, there is free help available. So the Health Connector has customer service, and we also have community partner organizations across Massachusetts. And the great thing about, well, I'll start with customer service. So the customer service number is here, 877-623-6765. For the RTTY number is 877-623-7773. Listed on our website, our hours of operation, etc. And you can also see local events that we are involved with on mahealthconnector.org/events. And what I was going to mention about the community partners is that these are the same folks that Elizabeth mentioned. She talked about navigators. She talked about certified application counselors. These folks will help you whether or not you're a MassHealth member or Health Connector member. They're really there to explain eligibility, explain the application. If you need to make a payment, explain those processes to you. And they can help you with understanding other rules and requirements for these programs. As Elizabeth mentioned, it's best to call ahead to make an appointment, and you can also find help near you. So you'll get all these slides, all of these links, and as well as other important links in the follow-up email. So our key takeaways. So those who lost access to MassHealth coverage and still need health or dental insurance can get that through the Health Connector. Again, you should update your application to find out what plans you qualify for and if these new savings are available to you. And the Health Connector offers coverage for individuals, families, and small employers in Massachusetts. Couple of more things to keep in mind. The Health Connector has certain deadlines. So our coverage always begins on the first day of each month. So there is an enrollment and payment deadline of the 23rd. So as an example, if you're looking for coverage to start on July 1, you need to enroll and pay by June 23rd. I think I've covered how you can apply for coverage either on your own or with help. But again, we really do want you to, take advantage of all the assistance that's available for you. If you need an appointment, go online, schedule that, or call. And again, there are many, many people who are here to help. So Neri and Elizabeth, I think we're ready for questions.
Oh,
Feels like there's quite a few in there. I have not checked.
All righty, thank you so much, Nikki and Elizabeth. Yes, we do have some great questions in the Q&A. So why don't we get started with just a reminder of the renewals timeline. So Elizabeth, if you can walk us again through the timeline of events, whether it's the time that someone receives a blue envelope and when they actually, their coverage ends. If you don't mind just giving us a general sense of that timeline once again, please.
Of course, great question. So when you receive your blue envelope, there will be a due date by which you need to respond. Generally, 45 days from when that arrives to you is when it will be due, but you need to respond by the date in your blue renewal form. If you don't reply or if you don't maintain coverage after you reply, you typically will have 14 days notice before you lose coverage.
Great, thank you. Oh, I apologize, I put myself on mute. Thank you, Elizabeth. So what if an individual experiences some discrepancy between the due date that is posted online and the blue envelope that they received? What is your recommendation?
I can't speak to the specifics of the case. We do build in a few days buffer because of mailing. So I'm guessing that the date online is the final due date, but doesn't include any buffer time. So I would make sure it's in the mail by that date in the paper renewal form.
Okay, thank you. And if an individual receives a request for additional information, let's say a proof of income, and let's say this individual has multiple taxable incomes. I'm not sure if you, Elizabeth, or Nikki can speak to this, but what is the recommended answer, I guess, for the type of income? How do they consider which income should be included when responding to the additional requests of information?
So I'm popping a link in the chat, which just includes a lot of great Q&A about income and how income is calculated. It can get pretty complicated, so I'd recommend folks take a look there for their specific situation. And of course, if they have questions, they can always call the contact center for help.
Great, thank you. We have a question related to COBRA and I guess understanding the comparable coverage options that are available, if any.
Absolutely. So that's a great question. I think if someone is looking at and comparing COBRA versus coming to the Health Connector, they're going to realize very quickly that when you are considering COBRA, you're actually would be continuing the health insurance coverage that your employer had. However, you're not going to get any assistance from the employer paying for that coverage. Now, that is typical. Sometimes people are contemplating COBRA or coming to the Health Connector, and they have a period in time in which the employer will pay a portion of that COBRA. So these are some things just to be aware of and to also ask your employer. Now, before someone decides to enroll in COBRA, it is a really good idea to take a look at the Health Connector and just compare and contrast the plans that are available to you against the plans that the COBRA plan that you're eligible for. And you may find that you can, modify some things, maybe modify the network, maybe increase your deductible so that you can pay a lower cost for coverage than what you would be paying in COBRA, or you may find out that you qualify for other subsidy. So it really is a good idea so that's my very long way to say yes, it's a good idea to come to the Health Connector before you do enroll in full cost COBRA to see what it is you may qualify for.
Great, thank you, Nikki. And when considering coming to the Health Connector, what is the best approach for identifying the best coverage, specifically when looking at my income? So I guess in other words, the different income brackets for identifying the right plan when applying for the Health Connector. How does the income play a factor in identifying that coverage?
Yep, no, this is a great question. And I think this, I'm going to try to, it's probably going to sound like I'm oversimplifying this, but I think what someone needs to do is just simply complete the application or get help completing the application and just make sure it's accurate. The system, the online application is going to give you a result, and depending on your own unique personal situation, you may in fact qualify for particular savings. So then you'll be able to compare and contrast plans that are available specifically to you based on where you live and your income and other eligibility factors. So when you're trying to choose between coverage, we always talk to people and encourage them to think about their own situation, consider whether or not they see specialists, whether or not there are specific facilities that they want to make sure they're able to see. And you can search when you see the plan results that are available to you, you can check to confirm that any preferred doctors or particular medications are covered in that plan and within that plan's network. So Nuri, I hope that helped answer that question. And if there's any other clarification, happy to answer.
Yeah, thank you, Nikki. I do think that answered the question. I am seeing a lot of questions here that are very situation specific. So we do want to continue to encourage folks to call the customer service center and help identify those correct responses. But I have another question here along the lines of completing an application. And let's say I'm in a household with multiple members and I am the only uninsured person. Do I need to include the other members of the household and their income despite them being insured?
I'm looking for Nikki to nod with me, but yes, you should include all members in your household because that helps us determine what coverage you're eligible for.
Absolutely. And I was also just going to add, people's households are all very different. And I think Elizabeth, from a MassHealth perspective, you think of households a certain way. From a Health Connector perspective, let's say there were 4 people living in a home, but they're not related and they really don't have anything to do with anyone's taxes. Each one of those 4 people could have their own application for health insurance coverage, but they would only be listing whomever is on their taxes. So we're most interested in tax filing households and making sure that, kind of within that family or non-family group, again, like I said, sometimes non-family, non-households live together, and those individuals would be looking for their own coverage. I hope that was helpful, Elizabeth, and not too confusing.
Thank you. I have a question here from the perspective of a student, specifically related to a connector plan. Are students, college students in particular, eligible for applying for the Health Connector if they are out-of-state students?
Okay, So I'm again probably going to oversimplify and just go back to the rules, and I will always ask colleagues if they want to jump in with anything, feel free. But Health Connector plans are available for Massachusetts residents. So sometimes we hear from students who are here kind of on a temporary basis. When you're completing an application for health insurance coverage in Massachusetts, you need to, again, answer everything completely and honestly, and you're asked whether or not you're intending to reside in Massachusetts. Now, if someone is, Nuri, are they a Massachusetts resident but going to school outside of Massachusetts? Or they're not a, so let's just say if someone is a Massachusetts resident, but they're going to school outside of Massachusetts, this coverage may not be the best option for them unless their intention is to only seek, care when they are, and I'm not even sure, pardon me, you know what, I think we're going to have to follow up on this because I'm actually thinking out loud saying, okay, you may only seek care when you are home, like during breaks, etc. Our plan, the Connector care plans and other health insurance plans, if you are out of state and there's an emergency, absolutely, you can seek care for an emergency, but I'm not sure whether or not the schools will accept these plans considering the networks are in Massachusetts. So I'm hoping I didn't over explain this, and we can certainly follow up and get more information about student coverage. Elizabeth, I'm not sure if this is an area that you can add on, but I think in terms of applying, I think like summarizing that, like the applying is for Massachusetts residents who intend to stay in Massachusetts.
Yep, would agree, Nikki.
Great. The next question here that I have is, how can someone best estimate their projected annual income? So whether they're a seasonal employee or self-employed, with income fluctuating week to week. I guess, what would you recommend as best practice?
Yeah, I would say do your best to average it over time. If you have historical data you can look at to say, normally I make $200 a month. Sometimes it's 100, sometimes it's 0, sometimes it's 400. But when I look at that across the year, it's about 200. I'd recommend doing your best to estimate what it looks like.
Thank you, Elizabeth. And going back to the Health Connector coverage options, and specifically about the Connector care, I guess there's a little bit of confusion there, Nikki, along the lines of the application and whether or not a separate application is required. So could you just clarify again the application process?
Yep, absolutely. So there is only one application for health insurance coverage in Massachusetts if you're interested in either MassHealth coverage, Health Connector coverage, or Health Connector coverage with savings. And really the great thing is that you don't need to think about what plan you're applying for or what program you're applying for. If you're under 65 years of age, you just simply need to complete the application at mahealthconnector.org, or you can complete a paper application or go in to get some help completing an application, and these folks will direct you. And it's that one application. It's, I don't want to call it a common application, but it's kind of like a common application. And based on your responses, the system will figure out which coverage and which savings you might be eligible for.
Thank you, Nikki. And is there a right time to apply for coverage? So specifically, let's say that right now I am employed, but I expect being unemployed. Like, should I wait until I am at that point in time in that scenario to apply, or can I apply now?
So I would say so the Health Connector has an open enrollment period. So beginning on November 1st, a person can start shopping and looking for coverage for January 1st. And they don't need any type of reason, almost like no explanation needed to apply for and enroll in coverage that's going to start on January 1. However, and I think Elizabeth will agree, if someone needs health insurance coverage, they should simply apply now. You never know kind of what type of special enrollment period or qualifying life event you are in fact are eligible for. And again, if someone is a current MassHealth member, you just need to update information. If someone has, or, if someone was a past MassHealth member, past Health Connector member, you would just need to go into your previous account, your previous application, and update your information. There's no need to complete a whole new application. We really want to be careful about creating duplicate or trying not to create a duplicate account for anyone, as that causes just, administrative hours for the person. But essentially, if you ever had coverage with us, update. And if you need coverage, just simply apply.
And what if I am already enrolled in coverage and need to submit a payment for my plan? What is the best way to do so?
Okay. If you're talking about Health Connector coverage and you need assistance with submitting a payment, you can pay by check, you can pay online, you can even call Health Connector customer service, and you can pay over the phone. Did I miss anything? Oh, actually, here's what I missed. You can only pay by using a checking or savings account. We do not accept credit card payment.
Thank you for the information, Nikki. And going back to the renewal process, what is the best way to identify the head of household, and also getting general assistance for completing the renewal form?
Yeah, of course. The renewal form will list the individuals on the application, and person 1 is most likely the head of household. You can always call the contact center with any questions. You can also look in your MA login account or in My Services to better understand your household. If you need support, you can call the contact center. You can go to a MassHealth enrollment center. There are 7 located across the state, or you can find a certified application counselor or navigator in your community who will be able to assist you.
Thank you, Elizabeth. Just going through these questions.
Mary, we've got great questions. I'm so happy people have stayed on. And really, I know people have been, just trying to think about their own situations and really kind of what next steps they need to take. So folks, we really appreciate you asking, getting clarification. These have been really good questions.
Sorry if you guys see any as well. Seeing a lot of situational questions, very specific to each household.
Yeah. So for the situational questions, maybe a couple of reminders will be helpful, because I'm sorry, folks, I'm not looking at the chat or Q&A. I'm relying on the summaries. So I just want to note, I mentioned a customer service center. Elizabeth mentioned a customer service center. Depending on, like, if you're a current MassHealth member and you want to call customer service, do call MassHealth customer service. If you are, if you're a Health Connector member, of course, call Health Connector customer service. But if you are just, you need assistance, you don't know exactly where you're going to land, it's okay. Call either one of those customer service centers. Someone can help you. If you go see a certified assister, like a certified application counselor or a navigator, they will help you regardless. They can help you with your unique situation. And even as Elizabeth mentioned, the MACs, the walk-in centers, same thing. You do not need to know like what you're going to be eligible for. They are just there to help you as a Massachusetts resident.
Righty, thank you, Nikki. So what is the best way to see what additional premiums someone will pay if they do decide to go for better coverage? I'm not sure if this is related to a benefits of summary page, but is there a way to, I guess, compare premiums and coverage options?
Yep, absolutely. So I just had this conversation on another call this morning. If someone is looking for coverage right now through the Health Connector, before completing an application, you can go to the Health Connector's website, mahealthconnector.org. In the upper left-hand corner, or maybe even the middle of the page, I apologize for not knowing, there's a Get an Estimate tool. The Get an Estimate tool will let you enter some basic information. You can see what plans are available in your area and what those costs might be. Then you would want to take that information and go to a plan finder tool that we also have on our website, where you can compare those plans and you can see which providers, like if there are specific providers or a specific network that you are really interested in, you can look it up using that tool. Now, if you've already made the commitment and you've completed the application, you'll see exactly what costs, what plans will cost you, what's available to you. And then you can also, within your own application, you can double check your providers and double check networks, double check medications. Now, I want to make sure I reference what Nuri was saying about the summary of benefits and coverage, like how can you really compare and contrast? You can look on the website, you can do a side-by-side comparison. You can compare the summary of benefits and coverage. And there is also an explanation of benefits that I believe you can download for each plan. And of course, you can call. You can call customer service or call a certified assister to just get reassurance and get help if you have questions about what something means. This isn't all intuitive. We're here to acknowledge that, and that's why we want to help answer questions and really help guide you to supports in your community.
Can I just add two more?
Yes,
I've seen a lot of questions about whether someone will get auto renewed, what are the rules? And it really depends based on the individual's information that's on file and the information that we can get from federal and state data sources. So while the groups I listed generally are more likely to auto renew, there's no hard and fast rule. And if you receive a blue envelope, then you need to reply. And it's most important to focus on making sure we have your updated address, your updated phone number, your updated email, so that when you are selected for renewal, we can contact you and let you know if you have to respond. So I understand that. And the second question I've gotten is around how to use e-submission. Individuals who can use e-submission will have that e-submission number on their renewal form in the blue envelope. If you don't have that number and you are over 65 or someone who lives in a long-term care facility or is in a waiver program, then you should complete your renewal over the phone or in person or by mail. Trying to catch the last few ones I saw come in.
Thank you, Elizabeth. Yes, we are almost coming to 2 o'clock. So if there are any final remarks, any final reminders that you guys would like to share, welcome them now.
Actually, Elizabeth, I'd like to hand it to you, just because, again, today's presentation was really about MassHealth renewals. So if there's anything more you want to provide or share, feel free.
Yes, I think the most important takeaways for folks is when you get that blue envelope, please respond. Even if you're not eligible for MassHealth, it will make sure you get the best coverage you're eligible for on the Health Connector. 2, if you haven't received your blue envelope yet, give us a call and give us your updated contact information. We'll be sending out blue envelopes until April 2024. So there's a lot of time. So no need to worry if you haven't gotten that blue envelope yet. Just make sure we have your updated information so we can reach you when the time comes.
Fantastic. And nothing more from my side other than please do open your mail. And if you're having any difficulty reading any of your mail, do reach out for some help to look through it, review it, and see what you need to do. So thanks so much, everyone, for taking time out of your day today to join us for the session.
Thank you, Nikki. Thank you, Elizabeth. And just to remind everyone that this presentation will be distributed along with all of the links afterwards. So thank you all for joining our webinar today. From everyone at MassHealth and the Health Connector and all of our sisters across Massachusetts, we wish you well, be safe, and thank you for joining. Goodbye.